What's up, beautiful people? I had posted in my Instagram stories that I was going to talk about the story that has been circulating of a woman who unfortunately had liver injury from high dose turmeric supplements and had to spend some time in the hospital. The good news is, according to the stories that I've read, that this wasn't permanent. She didn't need a liver transplant. So I'm happy that she appears to have recovered from this insult. But I wanted to discuss supplements again. A lot of these points I've already made before in other videos. The articles talked about the eightfold increase in the supplement related liver injury. I already did a video on that. You can find it on the YouTube channel. I'll also share that video after this to my Instagram stories. But I saw a lot of the same messages repeated by some of the anti-supplement people online about how there's no evidence that turmeric does anything and that supplements are unregulated and just dangerous. And I think that messaging is, quite frankly, intellectually lazy, because to someone like me who's trained in pharmacology, who is a licensed pharmacist, who has worked for, consulted, advised supplement companies, this is an area that I know very well. I wanted to talk about a couple of their points and put my two thoughts on the matter. So, we've talked about this before. When people say the supplement industry is unregulated, I think that's very intellectually lazy because it's not unregulated. It's differently regulated than prescription medications. So if I'm a pharmaceutical company and I want to get my drug approved from the FDA, I've got to do safety and efficacy trials, and I've got to prove that my drug has an acceptable safety profile and works for whatever I'm trying to do, whether that's cure cancer or improve quality of life or whatever. But for supplements, that's not the case. So supplements, you don't have to prove safety or efficacy before they come to market. Then the FDA cannot preemptively remove a supplement from the market. However, supplement companies are supposed to adhere, and I say supposed to CGMP. They're good manufacturing practices. These are how you make supplements and make prescription medications in the factory. There are certain guidelines to make sure that they're made safely. So, supplement companies are supposed to follow this. The really good ones will manufacture their products in FDA inspected facilities. So, the FDA will come in, will make sure everything is up to those good manufacturing practice or GMP standards. Other times you don't know. And that's where a lot of this, I think, comes from, is if you are buying supplements from places that aren't USP or NSF or CGMP, supplement companies that don't do third-party testing, I and a lot of other people like me view that as extremely unsafe because you, in that situation, don't know what you're getting. Now, the FDA can intervene if it gets reports of adverse effects, or maybe they're concerned that supplements are not including things that they say they're on the label, or including things that aren't on the label, or the dosages are off. They can intervene, they can fine, they can make these supplement companies send them letters saying, hey, you need to do this, and then they can recommend legal action against these supplement companies. So the onus is on you as a consumer, really, for supplements, where it's on the pharmaceutical company for prescription meds. But we have things like I mentioned, those third-party testing certifications you can look for. If you're looking for dosages, it's really, really important that we look at what are the literature showing is an effective dose. You can use things like Consensus, Examine.com to examine the evidence for a particular supplement and see if there is something there. The second point I want to look at is, to those of us trained in pharmacology, and I've talked to other pharmacists and other people who have PhDs in pharmacology, there literally is no difference from a physiological perspective between supplements and prescription medicines. There's a difference in regulation, and there's a difference in the quality of evidence before, supplements, again, they don't have to have safety or efficacy data before they come to market. Pharmaceuticals do, but there's a difference in the quality of evidence behind some of these interventions. And so some people, and it's their right, feel like some of the evidence behind certain supplements may not meet their bar to prescribe them or recommend them to their patients. And that's perfectly fine. Other people will look at particular supplements and say, hey, I think there's enough evidence here that as long as I give my patient informed consent, tell them the risks, the benefits, what we don't know, how to appropriately take them, then some practitioners are okay doing that. And I think that's perfectly fine. When I evaluate any supplement, I do it completely and totally in the same process that I evaluate prescription medications. Because as a pharmacist, this is one of the things that we're taught to do, how to evaluate drug trials and then make recommendations to patients and physicians about drug therapy. Pharmacists are the pharmacology experts. And so when I look at supplements, I'm looking at absorption, distribution, metabolism, elimination. I'm looking at supplement drug interactions, supplement disease state interactions, supplement nutrient interactions. The same as I look for at prescription medications. When I'm evaluating a patient's prescription medications, I'm looking for drug-drug interactions. I'm looking for drug-nutrient interactions. I'm looking for drug disease state interactions. These are things that pharmacists do all the time, and that's part of my training. And it doesn't vary whether it's a supplement or a prescription medication. Now, the third point I wanted to talk about was some people saying, well, there's no evidence of turmeric doing anything. And that is extraordinarily intellectually lazy because you can go online, look for turmeric meta-analysis, human randomized control trials, and some will pop up. In fact, I'll put one up here on the video. A lot of people take turmeric for knee pain or back pain. This was a meta-analysis of 16 randomized controlled trials with nearly 2,000 participants. They found that turmeric was effective in reducing knee pain and improving physical function compared to placebo, and actually had the studies where turmeric was compared to a class of medications called NSAIDs like ibuprofen, meloxicam, etc. They had a similar effect, and there was 12% fewer adverse effects in the turmeric group, and it was similar to placebo. The dose in the study was 80 to 2,000 milligrams a day. I'm going to talk about that dosing here in a minute. And there are some limitations. There are moderate risk of bias in these studies. So I can understand why some physicians would say, or healthcare providers would say that, I don't believe this is strong enough evidence for me. Others would say, I believe this is strong enough evidence. It all depends on your risk tolerance, right? But just saying that there's no evidence that turmeric does anything, that means that you've read every single turmeric study out there and have determined of all the probably hundreds of studies on turmeric. I don't even know how many studies there are. There's a lot. You've read all of them, and you've determined that for every single indication, every single condition it's been studied for, that the evidence was not strong enough. And that's not possible, right? I haven't even read every study on turmeric. So when you just say things, blanket statements like, oh, there's no evidence of anything is effective, that's intellectually lazy because there's some nuance there. It may be effective for this or not effective for this. It may be effective in this population, but not that population, right? And a lot of my videos are on supplements, and I try to provide that nuance associated with it. Now, I think there's a lot of bad actors in the supplement space for sure. And there's a lot of garbage supplements being recommended, but that doesn't mean that the entire supplement field is full of bad actors and none of it does anything, right? In line with that message, there's no supplement that I think everyone should take. There's no supplements I recommend for longevity. There's no supplements I recommend for weight loss. I almost never recommend supplements for hormones. So there's a lot in this space that people are doing that I don't agree with, right? But that doesn't necessarily mean that I don't think people can benefit from targeted supplementation from someone who knows what they're doing, takes a good history, looks at laboratory work, knows your goals, and then go from there. Now let's get back specifically to turmeric. In this article, it appears that the woman was taking it for joint pains after she saw a doctor online talk about it. I couldn't find what product that she took or if it had bioperine in it. More on that in a minute. But she was taking 2,250 milligrams of turmeric a day. That is a ton of turmeric. I never, ever, ever recommend over 1,000 milligrams. And I usually start people on 500. So maybe 250 twice a day if they're talking about for arthritis pains, knee pains, that kind of stuff. And then I do monitor people's liver function when I put them on it, because there have been reports of turmeric inducing liver damage. And if people are taking other medications or supplements that may be taxing on the liver, I may choose something else, right? And so this is where that knowledge comes in, to where here in the US, people aren't just going to get prescription medications off the counter and just popping them willy-nilly, but we can do that with supplements. And I think that can be very harmful if you have certain disease states or you're taking other medications. One of the big things with turmeric, and I've talked about this before, is it does impair the absorption of iron, and iron deficiency anemias are not rare in this country. So you have to be careful with that. People taking high dose turmeric and they already have low iron levels. It has been, like I mentioned before, reported with liver injury. If you look at what's causing most of the liver injury, and I talked about this in this previous study, it appears to be weight loss supplements, unspecified herbal supplements, and herbal teas. In general, I am much more cautious with herbal supplements than I am with vitamins and minerals. So I almost never recommend multi-herbal blends, because these herbals can have very potent effects, very potent interactions with each other, interactions with your physiology, interactions with your genetics, interactions with other supplements. And so if you're taking a high potency multiple supplement or multiple herbal product, that can be dangerous. And I've seen that happen very recently. I had a patient who was taking a adaptogen product that had 5 or 6 different adaptogens in it. They had an autoimmune disease, and one of the products in it is immunostimulatory. I can't think of a situation where I've recommended an immunostimulatory product to a patient who has autoimmune disease, right? So you have to be careful with these things. That patient ended up stopping that product. I checked in with her a few weeks later. She felt so much better after stopping that product. So in general, be careful with multi-blend supplements that are herbals. Be careful with supplements that have bioperine or black pepper. Bioperine or black pepper is meant to increase the bioavailability of supplements, and it does so by preventing the breakdown in the liver. And this can do it with supplements, prescription medications. It can also do it with items found in food. And so if you're taking a bunch of different things, maybe you have multiple supplements that have bioperine in it, we can run into some pretty bad problems, either from the supplements or the medications that you're on. So I'm very leery of using supplements that contain bioperine in it for these reasons. You have to be I'm not even going to talk about that because I don't even want to say it's okay for certain groups to use. I really don't like saying supplements are okay for everyone. I really like it when people go talk to people who know about this stuff, who can help guide them through it. And then with turmeric, it's been an arms race. Everybody keeps trying to make a more bioavailable, more potent turmeric product. And I understand why they want to do that. We've talked about musculoskeletal pains a lot on the channel before. It's a very common reason why people come and see a doctor like me. But that doesn't necessarily mean that we need to always have the most potent, most bioavailable product. And I've talked about this before. I think a big problem with the way most people do supplements is, number one, they think because it's natural, it's safe. Well, there's plenty of natural stuff that will kill you. Pit viper is natural, but I don't think we all want pit vipers biting us all the time, right? And I know that example is a little extreme, but there's plenty of natural stuff that will kill you. Mushrooms, certain fruits and stuff like that, berries that you eat that contain toxins, all that kind of stuff. So just because it's natural doesn't mean it's free of adverse effects. And then just because a little bit of something's good doesn't mean more of it is better. And so this arms race to continue making more potent, more bioavailable turmeric supplements is really concerning for me. And we don't often apply the same principles that we apply with prescription medications. And what I mean by this is, when I start someone on a medication, I don't start them on the max dose of that medication immediately. We titrate them up. But a lot of times with supplements, people don't do that. They start at the max dose. And we should approach these things like we do any type of pharmacologic agent. Find the minimum effective dose. I remember in pharmacy school, they teach us start low and go slow. And I think that more practitioners need to take that approach with supplements. Stop viewing them as a different category pharmacologically as prescription medication, and start prescribing them and recommending them like you would prescription medication. And so these doctors and other people online touting all of these supplements all the time, there's a reason I don't do that, because I view them the same as prescription medication. And I believe supplement recommendations have to be individualized and have to be done with care. So I hope you found this video informative. Y'all have a blessed day.